Okay, so again, thanks for joining us. I'm Julie B. Simone. I'm the program officer for the Mayor's Wellness Campaign. And today is our Healthy Town webinar, our Healthy Town application webinar, where we'll be doing a deep dive of the application. We do have a relatively small group. So my colleague Katie is going to be monitoring the chat, and I let her know that as we go through, if there's questions that it makes sense for me to just stop and answer on the spot, I think we can do that just to make it a little bit more informal and make sure that you're getting the answers to the questions that you need. So please feel free to use the chat or the question and answer box to do that. And then we'll also have time for questions at the end. So there's my contact information if you guys need it, but I think most of you have that already. Okay, and before we get started, I just want to take a second to thank our 2021 Crystal and Platinum sponsors. Without their sponsorship and support, we really would not be able to do all of this work throughout the state. Okay, and just a quick overview of the Quality Institute. We are the only independent, nonpartisan, nonprofit, multi-stakeholder advocate for healthcare quality in New Jersey. And we believe that collaboration is essential to improving healthcare, and that bringing together stakeholders from diverse settings is imperative to meeting these goals. And our mission is to improve the safety, quality, and affordability of healthcare for everyone. And so as I think you all know, the Mayor's Wellness Campaign is our statewide community health initiative, which is in partnership with the New Jersey State League of Municipalities. And this year, we're excited to be celebrating our 15th anniversary. The Mayor's Wellness Campaign is a program that gives mayors and community leaders tools and strategies to champion healthy and active living and to improve the overall health of their communities. And the Mayor's Wellness Campaign gives mayors and your staff and volunteers the platform and tools needed to make their communities a healthier place to live, work, and play. So why would you and your community want to become a healthy town? A healthy town designation is an opportunity for our Mayor's Wellness Campaign towns to be recognized for all of the great work that you're doing. And it really recognizes communities in which mayors have made healthy lifestyles a top priority, where you're actively engaging all members of the community through inclusive, evidence-based health and wellness programming, policies, and a culture of health. The Healthy Town designations are a great honor, and they're achieved through this competitive process with the application annually. So the designations are a great way to recognize your community's hard work, like I mentioned, and your dedication to improving health and wellness. Challenge your Mayor's Wellness Campaign team to maintain or improve upon your designation from last year and strengthen your programs. And then also you can utilize a designation to engage residents in the success of your program. The designations are not given to a set number of Mayor's Wellness Campaigns towns, but rather to towns who apply and meet the high standards defined in each town's, in each rubric, which we'll talk about in a few minutes. The Mayor's Wellness Campaign towns can be recognized in up to 3 categories. So our gold designation is a Healthy Town designation. The silver designation is Healthy Town to Watch, and bronze designation is Healthy Town Up and Coming. And so what we really like to see, and what many of you have done over the years, is kind of to work your way up through those tiers. As you know, I'm always available after your application comes in and gets awarded to sit down and talk with you and your team about how you can move your program up into that next designation tier. So just a little bit more about what it means to be in each of these tiers. For the gold designation of Healthy Town, these communities have well-established, engaged Mayor's Wellness committees that use research and local data, including social determinants of health, to assess the health of your community. They collaborate with local partners to implement programming, to reach health goals established for the year, and successfully evaluate your programming and have sustainability plans in place. For our our silver designation, Healthy Town to Watch, these communities are on their way to becoming a healthy town and have made a commitment to improving the health and wellness of your community. Along with key stakeholders, you have started to incorporate local data into programming, and you've identified ways to evaluate your programs. And then for our bronze designation, Healthy Towns Up and Coming, these communities have made the decision to focus on health and wellness, and they've started to invite important stakeholders to the table and offer healthy activity and education programming to residents. So now we're just going to walk through the application, and I'm really just going to give you some examples of what we're looking for in each question and talk through why we're why we're asking each of these questions. And as a reminder, the application is due January 14th, which is a Friday at 5 p.m. That deadline is a little bit earlier than we've had in the past, so just be sure to get that in on time. We won't be taking any late applications, and then our winners will be announced in March. Okay, so this is where you'll find the application on our website. It has my contact information here if you need it. Something that I want to mention, and I will mention it again before we're done here today, I really recommend taking the questions and answering them in a Word document, and then when you're ready to submit, just copying and pasting them into the website. There is an option to save your progress and come back to it, but we've had people have issues with that in the past. And I think that I definitely recommend working off of a Word document. That way you have all of the information and submitting it one time. And if anything gets glitchy on the website ends, you still have all of your data and you don't lose anything. Okay. So obviously we're just picking some, collecting some demographic information so that we know who's applying and where you're coming from. We're also asking you the last date that your Mayor's Wellness Campaign pledge was signed. I do have this information as well, but it helps to know that you guys are keeping track of that, and you can put the date in, but I can double check that if you need. So please let me know if you need help with that. The first question here really gives us the opportunity to get to know each town that's applying. So the designations are awarded with a holistic approach that requires us to really understand the demographics of your community and the challenges that you're facing. And this year, last year we did make some changes to the application based on the pandemic, and we felt that those changes were still relevant this year. So you're going to see those reflected again. We know that the pandemic continues to affect not only residents and health and wellness, obviously, but also your staff and the folks who are working on your Mayor's Wellness Campaign. And we want to really be cognizant of how that's affecting your ability to submit an application or do some of those tasks that we normally do on a regular Mayor's Wellness Campaign year. So for that reason, we know that there are capacity issues, and we tried to simplify this question again. So if you applied last year and there have been no major changes that you want to let us know about to your demographics, you can just put a note here that says C 2020 application. If you did not apply last year, then we do want you to give us some demographic information, or if there's anything that changed that you want to know, that you want us to know, you can. For question 2, sorry guys. I'm sure this will not be the last time that happens with my double screens. See? Okay. I don't know why every time I click, give me 1 second. Okay, sorry about that. In question 2 here, we are looking for demonstrable research that you've completed to determine your community health needs and how your programming addresses those needs. This is something that you guys have been hearing me say over the last 2 years, and it's really important that the programs that you're running are based on local data. I know that local data is challenging in New Jersey. We have a lot of small communities, and sometimes those communities are not reflected in the data that's found, but there are still some good ways, and we point those out in the toolkit and the handbook, and send you resources throughout the year. So we really want to just see some evidence that you've been looking at your community and trying to decide of what those needs are before you are picking programming. So for example, if you reviewed your local community health needs assessment and discovered that your community has a high rate of residents with diabetes, then we would look for programming that addresses diabetes, such as chronic disease management classes, opportunities for physical activity, access to healthy and affordable food, and education on healthy eating, just as some examples. However, we do recognize that this process may not have been completed this year due to the pandemic and other constraints that your health department or Mayor's Wellness Campaign Committee may have been under. So if that's the case, we are allowing you to use this space to describe your pandemic-related responses, whether you are still running some pandemic task forces that we know communities stood up during this time, or just if you're specifically looking at how the pandemic is affecting your community, you can tell us about that here. But again, the goal is to say, what have you been looking at in your community to determine what you should be using your Mayor's Wellness Campaign for? Question 3 is helping us to understand the makeup of your Mayor's Wellness Campaign committee. So another thing that I talk about a lot and that you see in the handbook is that successful communities are going to have a diverse group of stakeholders at the table that meet regularly to discuss the program. So for example, if you have your mayor, your public health officer, a school representative, a local business owner, and an employee from your local health system that meet on a quarterly basis, then you'd really be in good shape for this question. We know that not all of you are going to have committees, and so if you don't have one, you can just put NA. But let us know that that's not something that you have, because we can reach out and try to help you get one started for the next year. Okay, so in question 4, we're looking for evidence that you're using the social determinants of health model to think about wellness in your town. I've provided a link to help you further explore the 5 main areas of social determinants of health. If you're not familiar, chances are you're probably doing some of this work, even if that language is not familiar to you. In the question, you're going to choose one area and explain why you feel your town needs the most improvement in that area. And then also you're going to explain which area you feel that your town's doing really well in. So make sure to include some backup for why you're choosing each area, because this focus on social determinants of health supports a successful program. For example, last year, many of our Healthy Town winners utilized their programs to address food insecurity that they saw an increase in during the pandemic. Food insecurity was not something that a lot of Mayor's Wellness Campaign communities were focusing on, but it was something that changed last year and is directly related to social determinants of health. So those are the types of examples that we want to see. And again, there is a website there where you can have a little bit of background information, or if you need more clarification on that, feel free to reach out. So each of our towns have unique methods of promoting Mayor's Wellness Campaign events. And in question 5, we want to learn strategies that were most effective for your community. I think this has become even more important as programming and interactions have been moved to virtual platforms in this last year. And we also want to understand if you're connecting your program back to the statewide initiative with the Quality Institute. Do you send people to our website or note when you're using our tools and resources? These are the types of things that we're looking for in this question. Okay, so question 6 is really going to be the bulk of your application. You can list up to 10 of your most successful programs offered by your Mayor's Wellness Campaign, but I just want to remind everyone that this is only for 2021. So because the application and the designation is annual, we're not looking for programs that you ran in 2020 or back in 2018. We're specifically looking for programs that happened during the calendar year of 2021. You don't have to list 10, but you can list up to 10 of those programs. And for each of those programs, you really want to understand how the Mayor's Wellness Campaign health goals were addressed, how you targeted populations, and the content for the program. So be sure to address all of the parts of this question. This is where we'll really learn about the programs that you're offering and the impact that you're having on your community. So for example, it's great if your community held a local 5K, but tell me more about that in the application. We want the details. Explain what health goals were addressed, such as increasing physical activity and community connectedness. If social determinants were addressed, maybe you had available community resources to support those recreational activities, and who was your target population, your partner organizations, cost, did you have to charge residents, or if not, how did you pay for the event? What was the attendance like, and how did you evaluate the success of this program? So all of those pieces are going to be really important in that, and it is definitely, like I said, going to be the bulk of your application. Question 7 is going to give us an understanding of how you're incorporating the Quality Institute tools, resources, and program ideas into your local Mayor's Wellness Campaign. So if you're using a tool like a Walk with the Mayor, be sure to note that. Additionally, we put out the newsletter quarterly, and we give you examples of what other towns are doing in their communities. If you borrowed an idea from a neighboring community that you saw from our outreach, you can let us know. This is a good way for us to gauge a few things. One, are the tools that we're providing for you realistic and useful in your communities? And also, are you getting access to those tools as we put them out? We know that funding is a concern for our mayor's wellness campaigns. And in question 8, we're just looking for you to describe how you fund your programming. This is going to help us understand how we can best continue to support your program and develop best practices for other towns that we can share with them. A lot of times we will take the information that we get out of this application process and relay it to other towns who are asking questions about examples of what they can do in their communities. So this is another example of that. And in question 9, we're just looking for an approximate number of program participants for 2021. This helps us to understand the reach of your programs, but it also is a nice reminder to you guys. I know I'm constantly reminding you to evaluate your programs, and attendance is definitely one of those things that you can be doing to do that. If you're putting all this work into creating programs and you want to be able to show how many people were reached by that impact. So similarly, it's important to know whether your town's Mayor's Wellness Campaign programs are impacting your community in a meaningful way. And so in question 10, any of those evaluation efforts should be mentioned. For example, you might be doing pre and post surveys for your educational events. And so be sure to mention the results of those surveys. A lot of times we see that this is an area that people want to work on. And so if we know what you are doing currently, then we can create more tools or provide more guidance on how you can do that. Question 11 is going to give you the opportunity to describe how you used your Mayor's Wellness Campaign to respond to how you're continuing to use your Mayor's Wellness Campaign to respond to the pandemic. This can be still by moving your program. Maybe you're still running virtual programming or directly creating programs responding to the emerging needs like the food pantry or mental health services, which is what we saw a lot of last year. So again, just a chance to recognize that the pandemic did likely have an effect on your Mayor's Wellness Campaign and the programming that you decided to run in your community. Question 12 is going to invite you to share your plans for 2022. It's really more important than ever to have achievable goals set for the new year. Even though, there is still a lot of unknown, we want to hear, not only what programs you're thinking about running, but what health areas are you thinking about tackling? A lot of our communities have been running programs for, 10 to 15 years, and we want to see that you're progressing your program goals and really improving upon them. So this is a good place to show us that. Okay, in question 13, we want to learn, about your best practices and lessons learned from the work that you've done. One of the biggest questions that I get from communities is that they want to hear more about how their neighbors are doing and what other towns are doing so that they can learn, especially from those of you who have those healthy town designations and have kind of been put front and center as our healthy towns. The network of Mayor's Wellness Campaign volunteers are always looking for that kind of feedback. So this is a great place for you to share your ideas. This is what worked really well. This is something your town is excited about this year. And that way we can expand that impact by sharing that list with our other partners. And then in question 14, it gives you the opportunity to kind of let us know what else you'd like to see from us. I know we do the statewide survey, which hopefully everyone here has already submitted for the year. So we do collect a little bit more data on this, but this is just a chance for you to expand on that. If you have suggestions on what would be helpful for us to provide to you in tools, this is a great place to map that out. And then typically in these questions, I'm going to reach out and ask you for more information about that anyway. And then question 15 is optional. You can choose to attach no more than, it says no more than 3, but I think we give you more space than that. Here you can put flyers. We love pictures. You guys probably see that we utilize them in all of our materials for the year. So be sure to add any pictures of your events, flyers, policy briefings, newsletters, anything that you think really is going to help show the impact of your mayor's wellness campaign and how you're doing that in your community. I want to take a pause really quick before we move on to the rubric. Does anyone have any questions that you'd rather ask now and not wait until the end? I don't think I saw any in the chat, so I can move on, but I just wanted to check. No, okay. So we'll talk about the rubric. Let's see if I can. That big enough, Katie? It's kind of as good as it's gonna get because it's only letting me expand my other screen. The rubric, again, should be familiar to you guys. It is the same rubric that we've used in previous years. It's gonna walk you through the Robert Wood Johnson Foundation's Culture of Health criteria, and it is divided into 6 categories: defining health broadly, measuring data, measurement and data sharing, health equity, procurement of resources, and collaboration and commitment to sustainability. So these are the 5 areas that we're assessing through the rubric. As I've explained in the past, I really do walk through this rubric, and each of these questions is going to correlate to, each of these sections is going to correlate to the questions on the application. And I go through and just assign points, and then I add the points up at the end. And the number of points that you get is going to determine your designation level. So, try to keep it as objective as we possibly can. And you can see how it's broken down here for how many points you need for each section. In addition to this being the scoring tool, it is a really great planning tool for you and your communities to use throughout the year. I always recommend that, in January, as you're thinking about your upcoming year and those goals, that you take this rubric and say, okay, we want to be in this 3rd column over here where we're getting, the maximum number of points, and how can we create programs and plan our community events to make sure that that's happening. So yes, we use it as the grading tool for this application, but I really recommend that you all use it as a tool for your planning as well. And just as a side note, anyone who submitted a Healthy Town application last year, in the previous year, always receives 2 extra bonus points for your current application. So that's just something to consider when you're making sure that you're reapplying each year for these designations. See if we can get back to our. Okay, so just want to talk a little bit about some of the other winners, just to give you some ideas about what folks have done in the past. In the top left, you can see Evesham's Fallen Hero Tournament that they offered this year. In the top right, you can see Norwood Day, which is a first-time community event, which I think was really exciting during the pandemic to be kind of standing up a brand new activity and bringing folks back together in a safe way. And then the bottom left, Wildwood Crest Food Drive. Again, this was something that was really very prevalent throughout the state. We saw a lot of mayor's wellness campaigns leverage their programs to address the growing and new food insecurity they had not previously experienced. I also just want to talk a little bit about the benefits that you'll have access to once you successfully receive your designation. So in this year and the previous year, it was a little bit harder to celebrate these accomplishments, but every town receives a plaque and a banner to help you share your accomplishments with your residents and to encourage a culture of health in your community. You can see Freehold has their plaque and their banner up, and then Woodbridge had a ribbon cutting ceremony where I was able to go in person and give them their plaque. So those are really nice community events that just give you the chance to bring more recognition to your committee and also to the focus of health and wellness in your community. In addition, every year we publish a press release that highlights our winners. We provide towns with I already said that. We'll also highlight you in the newsletter and on our social media, and we'll also be highlighting all of the winners in an article in the League of Municipalities magazine. So a lot of great opportunities for kind of statewide recognition. Quality Institute staff is also available, like I said, to attend your events or to do an award presentation in your community, which is a great chance to recognize your committee members who have put all of their hard work into getting these programs off the ground and supported your work throughout the year. And it also makes community members more aware of your program. So that's one of the nice things about the visibility. It helps to increase engagement in the programs that you are pushing out. Okay, any other questions at this time? I'm not seeing any in the chat, but feel free to type those in. Give me a minute. Nothing. We must have all Healthy Town pros on the webinar today, which is great. So just a couple of quick reminders. In March of 2020, we did launch the Mayor's Wellness Campaign Handbook, and I really encourage you to use this as a resource. Not only, you know, again, as you go through your planning process, getting ready for 2022, it really gives you a step-by-step instruction on getting your program started or enhancing it, an annual checklist that guides activities throughout the year. So this is a great way to make sure that you're going to be able to check a lot of these boxes that are included in this application and on the rubric. It provides links to data and resource to help you conduct those localized health needs assessment. I will say that's one of the areas of this application that people seem to struggle with the most. So we really do try to provide some good resources for you to strengthen that portion of your application. It also has a press toolkit with sample documents for you to modify for your town and guidance on how to plan, implement, and really most importantly, evaluate your programs. You're also gonna find tips and opportunities to reach out to Quality Institute staff for support. So I'm always here to provide technical assistance, help connect you to resources, or to participate in your next council meeting. The handbook is available on our website, or you can let me know if you're interested in hard copies and I can mail those to you as well. Also, if you missed it, we do have the slides from our panel presentation at the League of Municipalities conference up on the website. I encourage you to take a look at it and learn some of the ways that towns continued their Mayor's Wellness Campaign programming throughout the pandemic. Municipalities leverage their programs to respond to the emerging needs, such as food insecurity, as I've mentioned, by opening Mayor's Wellness Campaign sponsored food pantries, and local Mayor's Wellness campaigns also developed virtual mindfulness, meditation, and yoga programs. 2 of our towns created point systems and hosted friendly competitions to increase accountability and keep their residents connected and active. And these are just a few of the ideas to help you to continue your program as the pandemic affects your ability to host your regular programming. So that PowerPoint, those PowerPoint slides are really going to give you a ton of great examples of ways that you can enhance your program for this year. So just something to take a look at. I see a question. And Councilman Ficarra is letting us know, and he's right. And I'm not sure if he's joking or not, but he said that once you get to the top award, it's hard to repeat. And I think that's true. And that's really where we're looking. Woodbridge has achieved that gold status, the healthy town. And so those are the folks that we're going to look to share their ideas and experiences with us to help other communities get to that point. And one thing that Woodbridge and a lot of our gold communities are doing is not just kind of doing the rinse, wash, repeat, but always challenging themselves and creating new programs as they move forward. So before we wrap up, I just want to let you know about some other activities that you can participate in these last couple months of the year and then starting in the new year. If you have not signed your pledge of participation for 2021, please do so. I've said, I'm sure you've seen my emails on that. So you can do that, or you can just go on our website, reminding you that it is an annual pledge. So we do ask you to redo that every year. And everyone that participates will be entered into the incentive drawing for the opportunity to win $1,000 towards your program. So again, if you have not signed that pledge, you still have a couple weeks to do so. The incentive drawing money can be used for activities in your community, such as exercise classes, purchasing something health and wellness related that you want to be able to distribute to your community, or offering free classes. So those are just a few of the ideas that we've seen those incentive funding has been used for. Additionally, I mentioned the statewide survey. I've also sent multiple emails out about that, but if you haven't received it, just let me know. We're really just looking to collect more data about your programs locally, what that looks like, what you're struggling with, what's going well, and how we can continue to support you. So we are asking you to fill out that survey again this year. And again, you'll be entered into the incentive drawing. You'll have 2 opportunities to win that funding if you do both of those activities. I also just want to mention our mental health initiative, which is sponsored by the Horizon Foundation for New Jersey. We're going to be hosting our final mental health first aid training on January 11th. I think right now we only have 3 spots left. So if there is someone in your community that you would like to have trained in mental health first aid, be sure to send me an email really today or tomorrow before we fill those spots. And it's a really great opportunity to support your community's mental health needs and really equip somebody in your town to be able to respond to the growing resident needs around mental health. And so I hope that you'll take advantage of these opportunities before the end of the year. Looks like we have a couple other questions. We'll make sure. Can you repeat where we can find the materials from the conference for us to review? Yes, so that's just going to be on our website, which I'm going to be sending out the recording of this webinar, and I'll also include the website as well. And that's where all of these resources can be found. Okay, is there another date for the mental health training? No, this is our 3rd of 3. So this is the final date for now. We are hoping to be able to continue to offer them in the future. So, you know, if that date isn't working for you or someone that you wanted to send along, stay tuned. We're hoping that that's something that we're going to be able to continue to offer. We've had really great feedback, and they've all been really important training. So we do hope to offer those in the future ongoing as just part of our regular programming. Let's see. So for the mental health training, 2 of our police officers have received training that covers the same topics. Oh, that one. Sorry. Topics that can be considered as a completed item. So unless we wouldn't really count that, you know, I think that's great we hope that especially your law enforcement, but really anyone in your community getting trained in mental health is obviously a positive and is going to make your community stronger and also support your mayor's wellness campaign. But we wouldn't count that towards, you know, a mayor's wellness campaign activity if it wasn't done through our training. I think that answers the question. Let me know if I missed it. Any other questions? So again, the application is live now. You should be able to access it. Really encourage you to work off of a Word document. We saw some loss of data last year. We don't want to see that happen again. So make sure that you're keeping that. It's also helpful to keep your answers, you know, on file for the coming years. And that way you have them and you don't need to reinvent the wheel for some of these. And the application is due on January 14th by 5 p.m. And I'm always available in the meantime to answer any questions that you might have about the application. And we're really here to just support the work that you guys are doing. So I don't see any other questions. This will be, like I mentioned, we are recording and we will be posting this on the website as well as our other presentations. So if you need to reference it, you can. And thank you all for attending and good luck with your applications.